Yes, Vani Gowda, get ready. It is your session now. Next, whoever wants to participate, speaking or whatever you want, you can just message me on my WhatsApp, all of you. Okay, I'll follow up one by one. So, Christopher is number one. Number two is Vani Gowda. Number three is Sarah. Number four is Sakina, like that, one by one. You message me on my WhatsApp and I will be conducting your, yeah, whatever you request, I'll be following it up. So, just message me on my WhatsApp, all of you. Right here we have um, Vani Gowda. Yes. Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we are
Yes.
conducting speaking sessions and here we have with us Vani Gowda. Hello Vani.
Hello, sir.
Yeah, you can start the session.
Okay. Good afternoon.
Good afternoon, nurse.
Please have a seat.
Yeah, thank you very much, nurse.
I'm Vani Shri, one of the registered nurses working in this public hospital. May I know what's bothering you?
Yeah, actually, I came
Mhm.
regarding my father. Okay, I
Okay.
am little bit worried and upset. I don't know what to do. I am visiting this hospital for my father, 81
Okay.
year old father, and
Okay.
he has been diagnosed as suffering from kidney failure, and he
Oh,
has to undergo tri-weekly dialysis program. I don't know anything about a dialysis nurse, so I would like to know some detailed information about my father's
oh.
condition and
Yes, definitely.
what does a kidney failure really mean?
Yes, yes. Definitely, I'm going to explain you regarding this kidney failure and all. First of all, I need to take some details regarding your father. So, may I know the patient name?
The patient's name, my father's name is Adam.
Adam. Okay. So, may I know what's your name in order to have your
Yeah,
better
my name is Charles.
Mrs. Charles. Okay, Mrs. Charles, I can understand your situation regarding your father's condition. So the thing is, I would like to ask one more thing. Does you already knows about dialysis or you completely not known regarding the dialysis?
I don't know anything, nurse. I'll be very thankful
Okay,
to you
okay.
if you kindly explain me in
Yes.
detail.
Yeah. I'm going to explain regarding the dialysis. So, before telling about the dialysis, I would like to explain the kidney failure so that you will be having an idea why dialysis is required when it comes to Aiden condition. Is that okay for you?
Yeah, of course, nurse.
Okay, Mrs. Charles, when it comes to kidney failure, there are no longer working, and what this is means literally, naturally, it is not working. That's why we are advising him to undergo for this dialysis. So, are you okay with this point?
Yeah, can you give me more detailed information, nurse? What are you going to do? What is the procedure and everything related to
Yes.
that one?
I hope you got my point, like what kidney failure means. Now I'm going to explain about the dialysis. So, dialysis is a kind of machine which cleans the blood. So, this is the main importance of dialysis. That's why we are advising him to go for thrice weekly, like a dialysis program. And these are the treatment which we can give to him because his kidneys are no longer working. I hope you are getting what I'm telling.
Yes, of course,
Yeah.
nurse.
Apart from that, do you have any questions?
Yeah.
Mhm.
Why does my father have to come 3 times a week?
That's a good question, Mrs. Charles. I can truly acknowledge your concern by telling you this word. So, why it is important mean naturally his kidneys are no longer working. That means he needs support from the machine, as I told you before. That is a dialysis program. So that's why it is very much necessary to undergo for this treatment, and it happened for the 3 times a week so that he can move his life in a better manner. Okay.
Yeah, nurse, of course. I can understand now what dialysis means. And will this dialysis, I mean,
Mhm.
will it improve my father's current medical condition?
Yes, Mrs. Charles. Like I appreciate your questions. By telling you this, I'm so sorry to tell you like this. When it comes to Aiden's condition, medical condition is unlikely to improve because it is very unlikely his kidneys will start working again. So that's why it is. I'm telling like it is unlikely to improve. But don't worry, we'll be having a specialist to take care of him. So I hope you're getting what I'm telling.
Yeah, nurse, of course. I understand that very
Yes,
clearly.
yes. So
And
apart from that, you
I
have
want
any
to know if
question?
this dialysis treatment is painful or does it have any side effects?
Yes, so yes, I can understand your worries. So I would like to give details about the treatment. It is yes painful. Why? Why? Because we are giving an injection. Like we'll be giving like a through a invasive procedure we are doing. No, so definitely you'll be having a pain. But don't worry. Yes, it has side effects such as fatigue and low blood pressure and muscle cramps and all. But it is very common when it comes to dialysis program.
Okay. And regarding my
Mhm.
father is 81 years old.
Yes, yes.
Then what could happen were he to decide not to continue his treatment?
Yes, as we consider his age factor also, it could happen due to his age condition and all. But don't worry, it'll be okay. Okay, we'll be having a specialist, as I told you before. We will take care of him in a good manner to continue this treatment. Okay.
Okay. That's
Yeah.
very nice of you, nurse. Thank you very much. Is there anything else that I need to know?
No, no. If you have any queries, you can approach me directly. I can help you with that. So apart from that, I hope you understood like whatever the points which I have covered. So, do you have any questions to clarify?
No, nurse. Thank you very
Oh,
much. You have given valid information, sound information. Thank you once again.
thank you, thank you.
Okay. Yeah. Now let me give you some feedback regarding this particular session. Yes. So, yeah, all of you, those who want to participate in the practice sessions, you can message me on WhatsApp and I'll write your name and I'll follow it up. Next point, next one, next who is going to take the speaking session? That's the Sakina Ahmad. So, number two is Sakina Ahmad. Sakina Ahmad will do the speaking session. If anybody is going to do the speaking session, you can message. Yeah, Grishma Shankaram is number three. Grishma Shankaram is number three. Okay. So number one finished. So number two is yeah, we are going to do like that. Shakina Ahmad is number two and Grishma is number three. Okay. So you message me on WhatsApp, whoever wants to participate. Okay. So now let me give you the feedback. Okay. Let me give you the feedback for today's session. What's happening? Yeah. Feedback for today's session. Yes. Yeah. Okay. Okay, let me check that one. Okay. Yeah. Yeah, this is for carer. Actually, yeah. So I have given the card, so she prepared. Fine. I put the carer one there. So no worry. I can put it there here. Yeah, this is the card. Here it is. Here is the card. You can prepare afterwards. But now, as of now, yeah, Shakina, we have given this card before. Yeah, yes. Next one. Okay, right. Now let us take the speaking session. Yeah. So pin. Yeah. Right. Now coming to the point, you had some grammatical errors. Yeah, especially with yeah, yes, grammar, third person, singular number. Okay, it, for example, I'll give you one sentence which you have said. It happen. It happens. Not it happen. It happens. Okay, but there is something called wrong collocation here. It happens. What happens? You mean dialysis happen or happens, but dialysis doesn't happen. Dialysis is scheduled. Dialysis is done or performed. Okay, so the dialysis machine will be operated. Okay, or you will use the dialysis machine. It happen is wrong here. So one is grammatical error, that is different thing, and the collocation. You have to say this dialysis is scheduled 3 times a week. It happens 3 times a week is wrong. It doesn't happen. It is made to happen actually. So it is scheduled for 3 times a week. It is scheduled for 3 times a week. Try to understand this. Okay. Try to understand this particular one. Right. So like this, there are some grammatical errors which you have to focus on. And next one, confidence wise, you're okay, but you have to build up more confidence. There's always room for improvement. So you can try some quality sentences. You can say like this: being a doctor, you're worrying about your father's condition. That is quite natural. And I agree with your concerns. You're free to ask me all your doubts. I'm ready to respond and answer your queries to the best of my knowledge. In case if I cannot give you the correct information regarding anything, there are two options. As far as possible, I'll try to solve your questions, but sometimes maybe my knowledge is not sufficient to clarify your questions. There are two options. One is I will discuss with the doctor and convey the message given by the doctor to you. That is the first option. If that is beyond my reason, then the doctor will give me a chance to schedule an appointment with you and you can clarify everything. How does that sound? So this is the way how you can speak to your. So what is already recorded and it is there on the YouTube. You can note down all these sentences from the YouTube. You can go to the transcript also, and there you can transcribe that one without the timings, and you can make a notes of it. You can use many different. The condition of your father is little bit serious. Extreme condition. It's neither mild nor moderate, but extreme condition. The condition warrants thrice weekly dialysis. If it is mild, once a week. If it is moderate, twice a week. But since your father's condition is extreme, serious, very serious, You're extremely serious. It warrants, it demands thrice weekly dialysis. It depends on the condition. There is nothing adjustment here. Your questions are quite reasonable. The very important question you asked is, will this dialysis improve my father's medical condition? I'm sorry to say, I'm afraid. I'm sorry to say, I beg your pardon, I forgive me. I have to tell you the fact. The fact of the matter is, this dialysis machine will no way improve your father's medical condition. There is nothing called a normalcy regain. It is as is and where is condition. We can help your father's condition not to deteriorate any further, and we can manage like this. That's all we can. The father's condition, kidneys are damaged, and the kidneys are in no way able to manage. So that is the reason why we are using this artificial method, because the natural process is not working anymore. I regret to say that there will not be any improvement in the condition. It is a status quo. All his life, this should go on. Yeah, if a kidney can be replaced, then that is a different option that we can discuss with the doctor. But as of now, until we have some other, this is a regular process. What if my father is 81 and he rejects to have this dialysis program? What is going to happen? Your questions are quite reasonable. But there is no option out. This is the one and only option. And you have to bow down to this option. There is no saying no. It's a must. Failing which, the conditions may deteriorate further. The contaminants, the poisonous material will be heaped in the blood and body. And these waste materials cannot be egested out. There is no exit. So, the condition will deteriorate even further. And the worst part is, it may result to the death also. I hope you understand the intensity of the condition or the seriousness of the problem. If your father does not agree, it is our collective responsibility to educate him and make him understand either by love or wisdom. Pass on the information and make him do it. Better go through this procedure thrice weekly rather than regretting for serious consequences or complications in the future. I hope you agree to what I say. Now it is on your shoulders to make your father understand, and by hook or crook, to get through this process. So this is the way how you can justify your points. Yeah. So where is this girl? Yeah. Vani Gowda.
Yes, sir.
Yeah, you can share your, no need to open your video. You can just talk and you can share your experience. How did this explanation benefit you? Was that useful? Did it add anything to the already existing knowledge for you?
Yes, sir. It was useful only. I have made so many mistakes, but mm, so so many words, so many phrases.
Yeah. So hope you understood the points.
Yes, sir.
Yeah. Go through all these things. And is there anything else you want to ask me? Do you have any doubts or any queries or any questions or any requests? Anything you can ask me now.
No, sir. Thank
Yes. Okay, fine. So now that you have finished your speaking, you can go and submit your writing today and I'll correct your writing task. Okay. Take any writing task and you can submit that writing and I'll correct it afterwards. Once the speaking sessions are through and you can get back to me, I'll schedule your writing correction also. Is that okay, Vani Gowda? Yeah. So that's the end of this particular session. And now we have the next one, that is Sakina Ahmed. Sakina Ahmed. Yeah, Sakina Ahmed. You can
Hello,
unmute. Yeah, are you available, Sakina Ahmed, for your speaking session?
yes, sir.
Yeah.
Good
So are
evening.
you ready or you need to prepare?
I am ready, sir.
You're ready. Okay. Others also. Next one is Grishma. You also prepare and be ready. Immediately after Sakina's session,